Good morning. I would first like to recognize the presence of U.S. Chargé d'Affaires, Mr. Stephen Fromm, President Dr. Richard Olds, Provost Dr. Alan Pensick, Vice Provost, International Development, Dr. Colin McPherson, Vice Provost, Educational Services, Dr. Glenn Jacobs, Keynote Speaker, Dr. Trevor Ames, Dean of the School of Veterinary Medicine, Dr. Timothy Ogilvie, Dean of Students, Dr. C.V. Rao, Dean of Basic Sciences, Dr. Marius Lucas, and all the faculty, staff, special invited guests, parents, students, ladies and gentlemen. I also wish to acknowledge all of the SGU SVM graduates present, and please stand. You may all applaud. You may be seated. Welcome to the 2016 SGU SVM White Coat Ceremony. Congratulations to all the new incoming students. You've made it. But this is where the real work begins. This is the beginning of a long, rewarding journey. My name is Dr. Jessica Harmon, and I am an SGU SVM 2013 graduate. Experiencing school in Grenada was a fantastic adventure. During my time here, I was an anatomy tutor, a pause facilitator, and I even sang in the vet band. After 6 terms in Grenada, I completed my 4th year at the University of Georgia. I felt well prepared thanks to my education here at SGU. I then completed an internship at the Riddle Equine Hospital in Lexington, Kentucky. After running anesthesia for the first half of the year, I was thrilled to be in the field as an ambulatory intern. I then moved to Indianapolis for an associate position at the McDavid Veterinary Clinic. We see horses in the field as well as the clinic for small minor surgical procedures. We also see small animal as well. One client stands out in my mind that recently called the clinic. His name was Tony. He had a horse that had been down all night. By the time I arrived, the horse had a whopping temperature of 93 degrees. I arrived and we began treating, but it was too late. After Tony's proper Native American ceremony that entailed singing, incense, and paint, I unfortunately had to euthanize the horse. He said he would now bring all of his animals to see me. He could see what a caring veterinarian I was. Little did I know, over the next month, I would see Tony's gelding that was castrated too late and impossible to catch in the field, a blue-eyed white devil pony, an old lame mare, thank God she was a saint, an incontinent dog with dementia, and a dog that drank a ton and urinated everywhere. But even with all of that, I was touched. I knew my education from SGU went past knowledge. It taught me to be a compassionate veterinarian and care for all of my patients. To all of the incoming students, this is an amazing, well-respected profession. I am so happy that all of you are joining it. Welcome to the SGU SVM. And now a brief history. The St. George's University School of Veterinary Medicine accepted its first class in August of 1999 and has accepted 2 classes each year since then. The SGU SVM conducts its 1st through 6th terms on the True Blue campus in Grenada, and then students complete their 4th clinical year at one of 29 affiliated universities in the US, UK, Canada, Ireland, and Australia. 2005 marked another milestone for the SVM when the Society of Phi Zeta, the National Veterinary Honor Society established for veterinary faculty and students, installed its first international chapter at the St. George's University. To date, SGU SVM has over 1,000 graduates from all over the world, including the US, UK, Canada, Sweden, Ireland, Trinidad and Tobago, Mexico, Colombia, Japan, Lesotho, Portugal, Germany, Botswana, Pakistan, South Africa, and Israel, who are all licensed to practice in 41 states in the US, UK, Canada, and Grenada. In September of 2011, the American Veterinary Medical Association Council on Education announced its full accreditation of the university's Doctor of Veterinary Medicine program for 7 years. SVM continues to strive toward establishing leading-edge veterinary knowledge and technology, expanding its curriculum and adding new state-of-the-art laboratories and classrooms. I now take great pleasure in introducing Dr. G. Richard Olds, President of St. George's University.
Well, good morning. It's a real privilege today to address you in the white coat ceremony. Our MC failed to mention I'm actually the new president. I've only been president for 4 months. And our founder, Chancellor Modica, remains the chancellor, but there had never been a president before. So I'm actually the first president of SGU. So thank you. As I was preparing for today, I'm a physician, and of course, as a physician, know a great deal about the history of the white coat, which you will don today. Many people think that the white coat, which is sort of synonymous with the health professions, has existed for centuries. That's actually not true. Actually, the white coat as a symbol of the health profession is relatively recent. It actually started at the beginning of the 20th century under the influences of two dynamics. The first, the wedding of health professional training with the scientific method. And if you will, the white coat or the laboratory coat is a symbol of that union between the science, if you will, of health and our profession. The other major influence was the understanding of bacteriology and infectious agents and the idea of the white coat as a sign of sterility. And as a result, those twin efforts led to physicians largely wearing white coats. Having said that, the white coat ceremony itself is relatively new. Started by Columbia University in the early 1990s. Actually, St. George's University is one of the first medical schools who actually have a white coat ceremony just 3 years later. And as is also the case, and probably symbolic of all the health professions uniting in one health, the white coat ceremony now is almost universal in medical schools, veterinary schools, dental schools, many nursing schools. And so today, you also will go through the process of donning the white coat as you begin the very beginning of your health professional training. Though I am a physician, I am actually a tropical disease specialist. And interestingly, the tropical disease that I'm an expert in is a zoonotic disease. So for my entire professional career, I've worked largely with veterinarians since actually animals are principally responsible for the transmission and maintenance of the Far Eastern strain of schistosomiasis, which is what I actually study. And so I know the importance of all the healthcare professionals on the unified theme of improving the health of our planet. So on behalf of the university, St. George's, I want to welcome you all to the health professions and specifically to the study of veterinary medicine. Thank you.
Thank you, Dr. Olds. I now invite to the podium Dr. Timothy Ogilvie, Dean of the School of Veterinary Medicine.
Well, good morning, everyone. It's a great day. We have a wonderful MC. Isn't she a great representative for St. George's University School of Veterinary Medicine? My welcome to all incoming students, not just incoming to the term and the university, St. George's University School of Veterinary Medicine, but to the profession of veterinary medicine. My sincere welcome. Welcome to all supporters, all family members. You are very vital to this process, and we cherish your support, and it's wonderful to see you here. My thanks to the faculty and the staff and other students who are with us today. Sometimes we don't take a step back and acknowledge or recall that putting on an event like this doesn't happen on its own. It's not just a spontaneous thing, and the staff worked very, very hard to pull this off and make it as ceremonial as it is. Would you join me in thanking the staff who organized all of this for this? Class, congratulations for choosing us, and thank you. And to the staff and faculty, thanks for choosing them. They're a wonderful group, and we congratulate us all on this wonderful event. This is my third year as dean, coming in as third-year dean here at the School of Veterinary Medicine. It's a wonderful place to be. Your students are in good hands with us, family and friends. They will get a tremendous education. I've been 41 years in the profession of veterinary medicine. It's a wonderful profession. As I told this class a couple weeks ago, they are entering a very honorable profession, always amongst the top 3 ranked professions in the world in terms of public recognition and public support. So because we're entering such a profession, an honorable profession, and because I've had such a wonderful 40 years into it, if you'd allow me just to give you 4 tips as an incoming class, tips that have served me well, and you'll forget them as soon as you leave the room, but maybe someday you'll remember them. The first tip I'd ask you to think about is to show up. If you show up and be there, you'll learn veterinary medicine and you'll absorb veterinary medicine and you'll participate in your own education in veterinary medicine. What's the old saying? Real change is made by those who show up and stick around. Come to class, be prepared to learn, be prepared to ask questions, absorb everything you can. It's a very fast 3 years and it's going to spin by before you know it. But you got to keep up. That's the other tip. Keep up in your studies. Don't get behind. It's a volume-intensive program. You have to learn a lot about a lot of different species, and you have to keep up. So please do so. If you find yourself slipping, we have a wonderful Department of Educational Services, a wonderful support structure here. It will help you regain that traction on keeping up. Third thing is to step up. You're in a profession now where because of your degree and because of your professional title, colleagues, community members, and others will be looking for you to step up. You'll assume leadership positions. Try it out here. Try stepping into leadership positions with us, members of clubs, members of SCAVMA. Try it out. You'll see that it feels pretty good. People will look to you for that leadership. And the final up is cheer up. This is a great place. You're going to have fun. You're going to learn in an international environment. You're going to learn in a cosmopolitan environment. You're going to learn in a different culture. And I think you have every opportunity to count your lucky stars and be cheerful. You know, and I'm thinking maybe Dr. Rao, Dean of Students, maybe we should have a grateful committee where we get together once in a while to count our lucky stars, because we should be grateful. We're in the healthcare profession. We're at St. George's University, and we're going to be great veterinarians. So speaking of grateful, I'm very grateful to bring up on stage our keynote speaker this morning, Dr. Trevor Ames, a colleague of mine. He's the Dean of the College of Veterinary Medicine at the University of Minnesota. He is a Canadian by birth, which kind of brings him a little close to me because I'm also Canadian. And he's the past president, the immediate past president of the Association of American Veterinary Medical Colleges now, which represent the 49 accredited schools around the world for veterinary medicine. So he's a leader. He has stepped up, and we're grateful to have him here. Please join me in welcoming him to the stage.
Well, good morning, students, family members, university leaders, and faculty. Thank you for the invitation to be part of the St. George University School of Veterinary Medicine White Coat ceremony. So I will stand on the authority of previous acknowledgments as I begin my address. I was certainly happy to be invited here to be part of this event for a number of reasons. I've known Dr. Ogilvie as a fellow dean for many years, and was pleased to have a chance to come down and visit with him over a few days. I've been involved in teaching St. George University School of Veterinary Medicine students at the University of Minnesota for many years, and have had the pleasure of visiting St. George University a number of times in the past. But I've not been back in 10 years, and so I was certainly looking forward to coming back and seeing the changes at the school, the changes on the island since my last visit. Additionally, have any of you checked the temperatures in Minnesota in January? Yeah, so that was another good reason to look forward to this visit. Yeah. So I think the ceremony represents an important milestone for the St. George University School of Veterinary Medicine and its class of 2020. It's all too easy to let these occasions pass without proper celebration. Today we recognize all of the hard work and efforts that you put in to be admitted into the St. George University veterinary school, and so we celebrate the beginning of that veterinary training. As you consider the education you'll receive, I think there's many similarities with the various phases that you'll progress through in your education and a construction or building project. So you can think that the foundation will be laid with hours of anatomy and physiology. The framework will be put up with classes on diseases, clinical diagnosis, and case management. And then you'll complete the educational building project when you receive your clinical training at a partner institution in North America or Europe. I've had the privilege of welcoming St. George University students to the University of Minnesota twice a year for at least 10 years, and first as a clinical department head and then more recently as a dean. It's always fun to welcome the tan, eager students from St. George University to Minnesota in January. And I'm always interested to hear about where they're from, what their career aspirations are, and they often will tell me that they've chosen the University of Minnesota for their clinical training because of our busy teaching hospital, our great flexibility with over 60 senior rotations to choose from, because we've been welcoming the Caribbean students seamlessly into our fourth year training for over 20 years. Okay, students, that was my one shameless plug for your training at the University of Minnesota. Many of the students I welcome each semester they're happy to be back in a big city, to be back in the U.S. They're ready to leave the island after 3 years. They're happy to find a Starbucks. But some have really grown to love the island, and they've embraced the island way of life. And those students are easy to spot. They're the ones with dreadlocks. So. Veterinary colleges mark this occasion of students being admitted into veterinary school by giving each of them a white coat, and you heard the history of the white coat. And it signifies your acceptance into an educational program before entering the wonderful profession of veterinary medicine. The white coat recognizes all that you've accomplished that qualifies you to enter training as a veterinarian. The white coat is a symbol of veterinary education, and for many of you, it may very well be the professional apparel that you wear for the rest of your career. But for others, it is a symbol, and you may end up wearing a business suit as a company executive or a government employee. You may end up wearing a lab coat, a research lab coat, doing research on an emerging disease. You may end up wearing coveralls consulting on a large dairy herd, or you may end up wearing a polo shirt with an equine clinic logo on it. The veterinary profession offers a diverse range of career paths. It's important for you to consider all of these opportunities as you progress through your training. White coat ceremony also serves to reinforce the common goals of the profession: ethical practice, scientific and technical expertise, and compassionate care, as you heard about from Jessica. Today, as you put on this coat, you signify to those around you, those in the audience today, and those that you will interact with daily for the rest of your careers, that you understand the professional, ethical, and social responsibilities of being a veterinarian. And so I would encourage you today to think of today not only as your entry into veterinary school, but also your entry into the profession, and begin practicing the ethical behavior and the responsible actions required of the graduate veterinarian. It may seem unusual to ask you to think about something that far in the future, especially when you want to just be sure you're okay for the next anatomy test. You may think that you have to focus all your efforts just to survive veterinary school because maybe you feel like you don't deserve to be in this class. I remember wondering how I got into veterinary school with all the other smart, more accomplished people in my class. In fact, it was not uncommon in the past for a veterinary school dean to ask the incoming students to look to the person to their left, and then to look to their person to the right, and then tell them that one of you will not be here next semester. I remember this was particularly alarming for me because I noticed the people on each side of me were both looking at me. In your case, I think you should go ahead and make friends to those sitting next to you, because there's a very good chance you'll be graduating with your classmates. The admissions committee at St. George's University School of Veterinary Medicine has checked you out pretty well. They believe you have the academic abilities to learn and understand the curriculum and the behavioral competencies to succeed in the profession. The School of Veterinary Medicine at St. George's University has a very low attrition rate because the admission committee does their work well, the faculty are excellent, and they work hard to make sure you succeed, and the support staff and the family environment of the campus provide an atmosphere of support for all students. So as I stated earlier, I encourage you to begin thinking about what it means to be a veterinarian and begin your preparations to enter the profession. As you begin your education, I think it's appropriate to remind you that veterinary medicine is a team sport. Your ability to work as a team member, communicate well, utilize the skills of others, will help you succeed in all phases of your veterinary medical education and veterinary training. 11 U.S. colleges of veterinary medicine conducted a study with surveys and focus groups and interviews involving hundreds of successful veterinarians. Based on that study, we know that an individual's ability to build relationships, communicate effectively, motivate and influence others, use sound judgment, think innovatively, strive for results, and demonstrate resilience and integrity are some of the most important traits that predict for your future success in the profession. These professional attributes are true across the profession, whether they're veterinarians in practice or veterinarians in research. Throughout your education, you'll have the opportunity to develop not only the skills and knowledge that you need to meet the standards set for graduates of an accredited veterinary college, but also the professional traits that will allow you to communicate with clients and guide them through the delicate and difficult experience of dealing with real-life issues such as the pain a family loses over, the pain a family feels over losing a beloved pet and family. And Jessica gave a great example of that story and how that connected her with a client. As you begin learning these professional skills, you've already begun learning them over the last week with your professional attributes workshop, or PAWS as it's called here. And these professional traits will not only help you succeed as a student, but after you graduate, the same traits will be just as important for your success as a veterinarian. Just as important as all the facts and knowledge you will learn over the next 4 years. You may be wondering if that can be true. But Banfield Pet Hospitals, the largest employer of veterinarians in the United States, cares deeply about these professional attributes. For each veterinarian they employ, the company measures not only the number of cases seen and the billing information, but also the ability to communicate, teamwork with the hospital staff, and also client satisfaction. Advancement within the Banfield system is dependent on success in all parameters, both veterinary and interpersonal. The SGU students that we admit into the clinical year of training at the University of Minnesota all go through the same interview process as students that we admit into our veterinary program as first-year students. When I've taken part in these interviews, I've been amazed at the wealth of experience the St. George University students gain by living and learning in a new country alongside students from many different parts of the world. As populations and countries of the world diversify, multicultural awareness will grow in importance. So your experience on this island will provide you invaluable experience to help you succeed in serving a diverse clientele in the future. And your backgrounds make you a very diverse group. I would encourage you to learn as much as you can from each other, as well as from your professors. There are 95 of you in this class, coming from at least 6 countries, and with 3 students from the Caribbean, which provides a great global perspective for you all. So whether the topic is the various uses and roles of animals in our society, or the many career paths you could choose or pursue as a veterinarian, the different roles of veterinarians in your home countries, or the biochemical pathways regulating glucose metabolism, I would encourage you to get to know your classmates, and I would encourage you to welcome the diversity that your class has to offer. I think you'll be amazed at the knowledge and the backgrounds that your classmates have and how they can challenge your perceptions and beliefs. You've now entered into what I think will be the most intense 4 years of your life. This will be the source of many memories and friendships that you'll keep for the rest of your life. And so I guarantee that when you gather at professional meetings in the years to come, you will swap stories about what happened here in vet school in Grenada, and these stories will make you laugh no matter how many times they're told. You probably have a story or 2 already from the PAWS experience. So I'm thrilled to see all the talented students being recognized here today have chosen to be part of the veterinary medicine profession. As Dean Ogilvie said, it's consistently rated as one of the most respected, honorable professions you could choose from. And in fact, recently, The profession was rated as the most respected profession in the United Kingdom. And it's often, in any of the countries that conduct these ratings, it's always very highly rated, as will be mentioned. So whether you choose a career in clinical practice, public practice, the military, industry, or higher education, there's no doubt that you're going to have a profound effect on society. And you may end up, many of you will have roles in your communities as the other family doctor, where you'll be caring for companion animals that help ensure our family's physical and psychological well-being. Others of you will choose paths that address some of the most critical issues affecting our world today: a safe and healthy food supply, conservation of our environment, and natural resources. Regardless of the path you choose, you're going to have a significant influence on the day-to-day quality of our lives in immeasurable ways. I'm confident that the education you will receive at St. George University will prepare and equip you with the knowledge, experience, and training that will allow you to make a difference in the lives of animals and people and the communities you serve. Your education as a comparative scientist will allow you to solve problems and deal with issues that cross traditional boundaries of discipline. When other health professions were trying to understand what was causing a unique neurologic disease in the people of New York City in 1999, veterinarians were asking a broader question of what neurologic disease could affect humans, horses, and birds, as all of these species were being affected. When other health professions in New York were struggling to interpret inconclusive laboratory data from affected people while walking past dead birds on their way to work, veterinary pathologists were examining post-mortem lesions from affected birds and horses and asking if this could be the first introduction of West Nile virus into North America. Before 1999, West Nile virus had only been reported in Africa, the Middle East, and Europe. But veterinarians led the way in discovering the introduction of West Nile virus into North America. Some doctors do work on more than one species. As veterinarians, you'll become One Health professionals with an education that is unique in the scientific community. With these disease threats facing us today that include infectious agents like salmonella, tuberculosis, influenza, and multi-drug resistant bacteria, you have an important role in dealing with these agents that can affect both animals and humans. Agencies such as the U.S. Center for Disease Control and the U.S. Agency for International Development have been frustrated with their attempts to control emerging diseases that control around the world. With the recognition that approximately 66% of emerging diseases arise from wild animal populations, these agencies are reaching out to the veterinary medicine profession to help find better ways to predict and respond to these emerging pandemic threats like never before. Diseases that cycle in wild animals may occasionally spill over into domestic animals due to overlapping areas of inhabitants. Any new diseases introduced into domestic animals can be amplified to the point where they spill over into the human caretaker. And for certain diseases like avian influenza and SARS, these diseases may then spread between humans. The U.S. government agencies I mentioned are now partnering with veterinary colleges to find ways to detect and predict when new diseases are emerging in wildlife and domestic animals, and devise ways to limit the spread before it becomes a human health risk. In addition, these same government agencies are partnering with veterinary colleges to train local health professionals, including nurses, physicians, and veterinarians, to create a One Health workforce in the hot zones of the world that can respond to these emerging pandemic threats and protect human and animal health. Each profession brings unique skill sets and training, and with the correct training, they can work together in a cohesive team with an understanding of the other profession's roles and responsibilities, and this always creates the best chance of success. Officials from the U.S. Agency for International Development credit the work of prepared One Health teams in East Africa with limiting the spread of Ebola last year and preventing the devastation that affected West Africa. These One Health teams did not exist in Liberia and Sierra Leone, where so much of the devastation occurred. Other countries in the world are also recognizing the value of the veterinary profession in controlling these emerging disease threats and are similarly seeing the importance of creating a One Health response. The role of veterinarians with non-transmitted diseases that affect both humans and animals, such as cancer or toxicities, is also growing rapidly. Scientists are finding that studying treatments for naturally occurring cancer in dogs has a much greater predictive value than studying treatment options in artificially induced rodent models. At the University of Minnesota, cancer researchers spanning animal and human medicine have developed vaccines from the tumor that have been used to extend the life expectancy of dogs with naturally occurring brain tumors by over 4 years when compared to standard therapies. And the life expectancy of cancer in dogs, and for the life expectancy for cancer in dogs, 1 dog year does equal 17 years. So if you can extend a dog's life by 1 year, you may be able to extend a human's life by 7 years. These vaccines are now being evaluated in human trials and are showing great promise. Similarly, researchers have found that naturally occurring refractory epilepsy in dogs can also provide a better disease model to study different therapeutic options for unresponsive cases than can these rodent models. Certain breeds of dogs, as you already know, may have an unusually high incidence of certain types of diseases, naturally occurring diseases. This allows much more rapid progress to be made in research on diseases where they are much less common in humans, and clinical trials in humans are difficult to complete. For diseases that are common in both dogs and people, like lymphosarcoma, the almost identical genetic makeup of the tumors make research for the different treatment options in the naturally occurring canine cases very valuable as well. And this concept of using human health research funds for treatment options in naturally occurring canine cases that can be funded by human health funds and then can then be used in these clinical trials in animals where the results help both animals and people. This has much greater acceptance than research done in induced disease models using laboratory animals. So class of 2020, I believe your future work at the interface of human and animal disease will continue to grow in importance. Veterinary students at St. George University have the opportunity to learn and even live in the same residence halls as medical and public health students. The St. George University School of Veterinary Medicine students can also take part in research and community outreach programs with other health professionals. Interprofessional health education is defined as learning about and learning from other health professional students. So what a great opportunity you have here to begin learning in this One Health environment. Finally, I think it's important to remind you that the degree you receive when you graduate from St. George University will carry both prestige and responsibility. In addition to today's oath, when you graduate from veterinary school, you will take the veterinary oath, where you will swear to uphold specific professional behaviors. As veterinarians, our actions and opinions should always be science-based, current, and informed. And as future leaders in the profession, your opinions on issues affecting animals will be highly regarded and valued. So this is not a thing that you should ever take lightly. Modeling professional behavior is something that you can begin focusing on today. On occasions such as this, I think we should take a moment to recognize the contributions of the students' families, friends, spouses, and others who have supported their educational and professional goals. Parents, remember those long nights helping your child memorize his or her multiplication tables? Or remember struggling to complete a science project on time? Today is your day to celebrate too. Your dedication and hard work has helped your child reach this milestone. So I would like to ask the veterinary students to stand, face the audience, and why don't we give your supporters a round of applause. Please be seated. So thank you for this opportunity to be with you today. Congratulations, class of 2020. Enjoy this milestone. Thank you.
Thank you, Dr. Ames, for those inspiring words. Now, based on recommendations made by the AVMA, SGU SVM introduced a professionalism course for the incoming class in its first component. A 2-day professional attributes workshop called PAUSE was recently completed. We will see a slideshow at the end of the presentation. It is befitting, no judgment. It is befitting that after completing this professionalism workshop, you are officially welcomed into the Veterinary Society. The white coat serves as a symbol of professionalism and to welcome each of you to the veterinary medical profession. SGU SVM will now present you with a white coat. It symbolizes your entry to the profession and your commitment to uphold the duties of the profession. Robing at the white coat ceremony is considered to be an honor and must be pre-approved. To assist our keynote speaker and myself with the robing, I invite to the stage Dr. Timothy Ogilvie, Dr. Mohammed Bayat, and Dr. Rolf Larson. Please come to the stage. In recognition of our international enrollment, Dr. Gemma Tyner, Assistant Professor in the Large Animal Medicine and Surgery Department, will call each student by name and state their country of birth. Please hold your applause until all students have been robed. For safety, we ask the audience to kindly remain seated and not interrupt the ceremony by taking pictures in the forward section of the hall. Thank you for your cooperation. Dr. Ames, you may come.
Carlos Smith, Florida, USA. Jaylene Harris, USA. Grenada, sorry. Isabel Pajak, Illinois, USA. Megan Bolash, Pennsylvania, USA. Shakina Morris, Texas, Germany. Chandra Lilly, Pennsylvania, USA. Sammy Parent, Ontario, Canada. Melissa Brock, Texas, USA. Amber Lee, Texas, USA. Elizabeth Ann Flatt, Georgia, USA. Stella Espanan Fahul, Puerto Rico. Michelle Mack, California, USA. Taylor Boyett, Georgia, USA. Tabitha Wickett, Indiana, USA. Megan Teagues, North Dakota, USA. Paige Moritz, Illinois, USA. Alyssa Drozinski, New York, USA. Tiffany Feltz, Minnesota, South Korea. Madeline Shea Boys, Washington State, USA. Samantha Verzi, New York, USA. Lauren Gerke, Virginia, USA. Shabina Chowdhury, Ontario, Canada. Ashley Diaz, Missouri, USA. Nick Marquette, Connecticut, USA. Jinan Bagdonas, California, USA. Amber Weaver, Pennsylvania, USA. Amanda Lee Smith, Maryland, USA. Kayla Akaya, New York, USA. Adam Tate, Oregon, USA. Brandon Jacobson, Louisiana, USA. Lindsay Cherise Thayer, Washington, USA. Tamara Hawkley, Alberta, Canada. Janelle Komnick, Indiana, USA. Kate Sullenberger, California, USA. Samantha Joanne Mag, Maryland, USA. Jonathan McDowell, Ontario, Canada. Shelby Drake, Alaska, USA. Aubrey Smith, Kentucky, USA. Lauren Bramlett, Kentucky, USA. Samantha Rose Gertz, Massachusetts, USA. Heather Ann Cranston, California, USA. Sarah Spence, Tennessee, USA. Sarah Courtright, New Jersey, USA. Patrick Kowaleski, Philadelphia, USA. Joshua Peterson, Minnesota, USA. Stephanie Lacoyo, Georgia, USA. Talara Arua, California. Thank you. Alexander Gascoigne, England. Rachel Claassen, Virginia, USA. Sally Dry, Kenya. Bridget Ryan-Muller, Ontario, Canada. Kristen Mantisanto, New York, USA. Marcy Kanuka, Alberta, Canada. Mackenzie Airsom, Florida, USA. Adrian Ballanoris, Houston, Texas. Nancy Marutzis, New York, USA. Selena Samnani, Alberta, Canada. Logan Boyle, Wisconsin, USA. Tony Blanco Kung, California, USA. Monica Tetnowski, California, USA. Abby Fitzgerald, Michigan, USA. Jeremy Wynn, California, USA. Alok Desai, Michigan, USA. Caroline Steinbeiser, New Hampshire, USA. Close enough. Sarah Wilkinson, New Hampshire, USA. Gabrielle Bergerman, Gilbert, Arizona, USA. Christina Rivera, Florida, Germany. Elizabeth Ann Fox, Maryland, USA. Dwayne Pierce, Florida, USA. Vanessa Priorone, New Jersey, USA. David Chabelis, Maryland, United States. Benjamin Jacobak, Toronto, Ontario, Canada. Alexi Baja, Michigan, USA. Samantha Joyce Stevens, Washington, USA. Travis S. Hamilton, Missouri, USA. Caitlin Moreland, South Carolina, USA. Peter Gibbons, Tennessee, USA. Allison Childers, Alabama, USA. Lilia Barden, Connecticut, USA. Emily Bowman, Florida, USA. Caitlin Nordberg, USA. Hannah Jacobs, North Carolina, USA. Kennedy Brooks, Alberta, Canada. Rachel Madaxi, New York, USA. Amanda Shedd, New York, USA. Corinne Crosby, California, USA. Rebecca Guy, Grenada. Darnell Blackman, New Jersey, Trinidad Tobago. John Andelfeld, New Jersey, USA. Kristen Valerio, New York, America. And Libby Munhall, Arizona, America.
I now invite Dr. Nikki Wise, Associate Professor in the Large Animal Medicine and Surgery Department, School of Veterinary Medicine, to lead the students and all veterinarians present in reciting aloud the professional comment listed near the back of your program.
Thank you, Jessica. Could I have all the veterinarians in the audience please stand? Almost. Few more years. I know, it's good. Can I also ask all the veterinary students in the audience to please stand? And please recite the professional commitment with me. Being accepted into the profession of veterinary medicine, I solemnly swear to further my knowledge and skills for the benefit of society through the protection of animal health, the relief of animal suffering, the conservation of animal resources, the promotion of public health, and the advancement of medical knowledge. I will conduct my studies conscientiously, with dignity, and in keeping with the principles of veterinary medical ethics. I accept my responsibility to assist my colleagues to achieve our mutual goals. I acknowledge my obligation to adhere to the university's honor code and to conduct myself with integrity and ethical manner at all times. It is a privilege to be given the opportunity to become a veterinarian. I will be ever conscious of that privilege, never abuse it. Congratulations.
Thank you, Dr. Wise. Please be seated. As stated earlier, the incoming class has just completed a professional attributes workshop referred to as PAWS. PAWS focuses on the development of those life skills which you need besides your technical veterinary skills. Skills relating to communication, teamwork, and professionalism. These are skills and attitudes which make you into a more complete and well-rounded person. A person that is not only a technically excellent veterinarian, but is a successful veterinarian. And to be a successful veterinarian, you need to have excellent people skills. You need to be a responsible member of a team. You also need to become a servant leader, a leader who supports, cares, and guides the team you will work with, as well as your clients. Without such competencies, especially our ability to relate to and communicate with our clients, we will fail to fulfill our veterinary obligation to be spokespersons for those who cannot speak for themselves, our animal patients, and to use our skills for the benefit of society. The PAWS student facilitators will now share some of their experiences with you through a special presentation. Okay, guys, hit it. I ask that you please remain seated and keep the aisles clear and wait until directed by the ushers to exit. Thank you again for coming. Congratulations.